Welcome to Behavioral Health Today, a podcast by Triad Behavioral Health, where we cover trending topics in behavioral and mental health. This podcast is designed to share unique and relevant topics occurring within the world, our communities, and bring them a mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Dr. Graham Taylor, and today my guest is Russ Glass. Russ is the CEO of Ginger, an online demand mental health company. Russ also has experience leading products for LinkedIn, as well as being the former founder and CEO of Bizzo. He is also the co-author of the book, The Big Data-Driven Business. Russ joins us today to talk about Ginger and his experience in telemental health and the unique integration of mental health with data-driven software. Russ, welcome to our show.
Thanks so much for having me.
I am really excited about our time together, as the need for access to mental health care is really at an all-time high. You know, as we're going into this time in this season of our lives, mental health issues are rising and the need for access to mental health care has been just soaring. And with the stay-at-home orders due to COVID, telemental health, as I've seen it over the last several months, has quickly become the sole option for many Americans in need of mental health care. So with these mental health needs rising, so is real-time access to care. So what I'd love to have you just start us out with is tell us about Ginger as a mental health app and how you're geared to increase access to care via your virtual platform.
Ginger, interestingly, saw a huge need in mental health before COVID. And we'll get back to COVID in a minute. Yeah. But I mean, if you look prior to this period, the need was massive. There are far more people who have a need for care than are getting it. There's shortages across the country. In fact, 50% of US counties have zero mental health providers within county lines. 60% of people diagnosed with mental health issues are not getting effective care today. Yeah. And it's getting worse over time. Yeah. The incidence rates of anxiety, depression, suicidality are all going up, again, pre-COVID. And the number of providers going into the space is going down. So you effectively have this huge supply-demand imbalance problem. Far more people need care than can get care. And that, before COVID, was leading to a situation where people couldn't get access. So they would call therapists, they would call psychiatrists, and they wouldn't get return calls.
Right.
They would hear, we're not taking new patients. They would hear, we can get you in 2 months, which if you have a behavioral health problem is a massive issue.
You need access to care right then and there.
Yeah, you need care because it gets more and more acute, and that's how you get people in the emergency room with suicidality and other issues. So huge problem. And then of course, COVID hits.
That's right.
And all of a sudden we're seeing an exponential increase in these problems. So Ginger has been designed to try to solve the supply-demand imbalance. We recognized the traditional way of solving this problem, this network of providers that health plans are putting together, isn't working. We have to use technology. We have to figure out virtual delivery of care. We have to use data and understand how you scale each individual provider to be able to support more people. And that's the system that Ginger has built. You can think of us as a highly scalable, high quality, entirely virtual mental health provider.
I really like that. Online virtual care has really allowed, as you're saying, a number of people to access care in ways we would likely not normally do it. I know there's a stigma, unfortunately, around mental health services. And I know that, you know, for those that are first-time folks, being able to have a portal to come into in a confidential way reduces some of the stigma, allows greater accessibility. I also know that you folks, being in 50 states, 19 countries, I know there's also 24 access to care. So that access to care is a real cornerstone piece. People can call anytime they want, not just during business hours.
Great points. There are a number of things that I would say make Ginger different. First is we recognize the importance of evidence-based care and of collaborative care. So we know that people's needs are going to be different. We realize that everybody's going to need a personalized approach to care. There's no one solution. Depending on the person who comes in, you want to deliver the kind of care they need. We start everybody with a behavioral health coach. So that is Difference one, every single person at Ginger gets longitudinal access to a behavioral health coach. To your point, that care is available 24 hours a day, 7 days a week. Secondly, those coaches are there to support those people in a chat-based modality. So it's almost like, think of it like a HIPAA compliant, so totally secure Facebook Messenger kind of an experience where you're interacting with that coach. That coach is helping you to understand what your needs are. They're bringing content to the table, exercises. We have over 200 different activity cards, something called cognitive behavioral therapy, so digitized versions of that, meditation, mindfulness, breathing exercises that help you both in the moment. So if you're having a panic attack, we're helping you feel better in the moment, but now working with you to develop a plan so that we're going to improve your behavioral health issues over time. 15% of the time, people need more care than that. And that's the second big difference. So we have these coaches now as a huge differentiator, available 24/7. The second big differentiator is we don't refer you out to a therapist or a psychiatrist if medication management is needed. We actually bring those people into the care team. So now you might have a therapist and a coach, or you might have a therapist, a psychiatrist, and a coach. Those providers are coming in via video. And in between those sessions, the coaches are working in collaboration to make sure you're accomplishing the things that that therapist needs you to accomplish, or that psychiatrist wants you to accomplish. And in doing that, it allows us to get people through therapy faster and then provide the coaches step-down care so we don't have recidivism. That entire process is hugely differentiated. And we see people getting healthy far faster. So 3 to 4 times the standard of care in terms of how fast they're getting healthy. We see that they don't relapse into higher levels of care again. And so those needed hours can go to other people who need them.
Yeah, that is really unique. I love the idea of coming in and having somebody right away help you understand what's going on. A lot of times when we're caught up in a mental health situation, we don't know what we don't know. We're just not feeling very good at all. And there's a lot of uncertainty, fear. My sense too is that you're encouraging people to seek services early in their psychological experience. Let's say when an issue may be at a subclinical level and before they reach maybe more of a clinical level of distress, almost like an early detection, early intervention. It seems like seeking to kind of mitigate the potential severity of one's mental health issues. Get in early, let's understand this, put a plan into place, and get you to a greater level of mental health.
You're getting right into that third differentiator. That's exactly right. We believe that when somebody is acute, it's harder to get them back on track.
Absolutely.
They often have comorbidities that were part of the mental health issue that they've been dealing with, whether that be things like diabetes because they're not getting the exercise that they need to be getting, or they're not eating as well as they could be. They might have heart conditions because of similar reasons. They might have musculoskeletal conditions. We see about 60% of behavioral health issues come comorbid with some physical ailment. If you can get people sooner, if you can get them upstream in a preventative health mindset, which these behavioral health coaches are great at, you can prevent them from getting acute. You can give them strategies to recognize when they might be heading down the wrong path and give them tactics. And importantly, as we start to talk about COVID times, resilience, because it's resilience that's going to help people get through these hard periods. And you can train on resilience. You can train on building those capabilities within your mind, within your psyche, so that you can help prevent some of the more serious issues down the road.
You bet. A colleague of mine and I are putting together a talk through some of the news agencies here. We're calling it Mental Health PPE, gearing up psychologically for the second wave in anticipation. These are things that we're incorporating aspects of stress inoculation, resiliency building like you're talking about. And these are all things that we can do to get out in front of the next wave, and psychological tools that we can implement here. You're talking about the different professionals you have, and I'd love to hear about the various folks. You get behavioral coaches, practitioners, psychiatry. So you've got, it sounds like the full spectrum of a multidisciplinary team being put together. I'd like to ask another question, but tell me about the professionals that you have and the folks that are on staff, and what would I would expect coming in and who I'd be working with just typically?
They're a very special part of what we've built. That the behavioral health coaches tend to be master's level professionals.
Okay.
They usually have a behavioral health coaching certificate from one of the large universities that provide the program. So Duke is one of them, Michigan, Columbia, UCLA. Yeah, great programs, great schools. These coaches then come into Ginger having at least 6 months to a year of clinical oversight on providing this kind of coaching. And then we provide 200 hours a year of training ourselves. And we're training on things like modality. So how do you provide empathy in the chat?
Yeah.
We provide training on how do you interact with our technology. So we have, and this is another core differentiation of ours, we're monitoring those chats in real time. We're making recommendations to the coach on suicidality risk, on next best action. We're actually providing them language based on the conversation that they can respond with. It helps us maintain quality. It helps them to reinforce what they might be thinking this person needs. It helps them to monitor over time. So you can imagine if you've been working with somebody for, let's say, 3 months, you might forget something that they said 8 weeks ago, but the system doesn't forget that. And so it can continue to resurface insights that might be valuable to that coach to provide the best care. So those coaches are extremely well trained, and then they're supported by our technology. Our therapists and psychiatrists all go through an extreme vetting process as if they were being hired by us like any other employee. We're looking at backgrounds, we're looking at experience, we're looking and validating evidence-based care modalities. So we're using people who use the best practices in the field. We're looking for measurement-based focus. So we want them using all the data Ginger's bringing to the table to make good decisions about care. But ultimately, we're going to trust them. So we're hiring great people. We're providing them measurement and great information. And then we're going to trust them to make great decisions about the care that they're providing with clinical oversight. And all of that is, believe it or not, pretty unique in the space. The state of the art today is not that sophisticated.
No, that is really sophisticated and extremely unique, just, from the general telehealth or businesses now that just have therapists online. This is really an integrated process. And how cool it must be to be a clinician, with Ginger, to have, mentorship and almost kind of consultation in an ongoing real-time way when you're working with somebody. Sometimes you get caught up in the weeds with what's going on, but to have information presented to you in a real-time format while you're talking with somebody, to consider what you may be going down or asking would be a really nice additional piece.
100%. I think our vision is that every provider at some point will have access to this kind of data and this kind of information. And today, our Ginger providers have it, and it's immensely powerful for them to be able to provide great care and get people healthy faster. But for us to accomplish this vision of a world where mental health is never an obstacle, it's going to take every provider providing care this way. It's going to take an entire rethink to how you support people with these issues. And our hope is that over time, we'll be able to take this way of doing things and distribute it in a highly efficient, effective way so that all care providers, if they want to be at the top of their game and support people at the state of the art in the best way possible, in the most scalable way possible, they'll use these systems to do that.
Yeah, it's really good. Thinking as a clinician, there are various levels of acuity that folks come in with. Some are just coming in with, new symptoms that are arising. And a lot of times they're just circumstantial in nature. Maybe it's a relationship conflict or work stressor, a loss, et cetera, that they just got to work through. And not to minimize that, but that's fairly treatable. You can help reduce symptoms, increase control, develop some emotional muscle along the way, enhance develop an enhanced, skill set that they can take into their life. There are times, though, as you know, where someone's issues are pretty deeply rooted, trauma, et cetera, family of origin issues that are very deeply rooted, a lot of times outside of consciousness. So it seems like if we were to look at two levels of care, just to keep the illustration simple, one would come in, get some skills, get some symptom relief, get some ways to manage and approach to things to reduce the distress that they're experiencing. And they get to take those tools that they develop with the behavioral coaches and the therapist help and go into their lives more effectively equipped, which is pretty cool. The other folks are going to be a little bit more long-term, likely requiring additional care, additional things to be looked at, family of origin stuff, trauma-based work. How is that done with those folks that come in and those types of presentations being identified? What do you do with them?
The simple way that I think is an oversimplification, so caveat it, but the simple way to think about it is a coach helps you look forward and a therapist helps you look backwards. So what we're really trying to do at that next level, when we're bringing a clinician like a therapist in, is to look into things like trauma, grief, other areas that you might have to work through in order to go forward, things that may be blocking you from being able to go forward. And then we bring a psychiatrist in when medication may be helpful to unblocking some of the things that are blocking you, whether because of chemical imbalance or whether because the trauma is so severe that getting you to the point where you can work on it requires some medication assistance. So there is a lot that we can do virtually through this collaborative care model on both, to your point, the preventative care side, the looking forward side, as well as the digging deeper and looking rearward to unblock you from being able to move forward. Let's say 90+% of people we'll come across are going to be in that range. It's actually far higher. It's like 98% are going to be in that range of need that we can handle through these different modalities. And the amount of care they need will vary. On average, someone who is escalated to therapy needs 7.4 sessions with the therapist before they can be stepped back down to coaching. Some people need far more. And then some people require more than what virtual care can provide. Okay. And that's where we are going to do a warm handoff. We're going to refer them out to inpatient treatment resources, in-person treatment resources. And this might be something like a substance abuse disorder. It's going to require some sort of inpatient treatment, controlled substance prescription, eating disorders where nutritional monitoring is going to be important. So there are different areas that we may disqualify ourselves.
Yeah, I get it.
But the vast majority of our members can be handled in this virtual means.
That's really good. Really good. I know a good number of businesses are looking to provide mental health services to enhance their employees' lives and their work productivity. What do you see the role of the employer being in providing mental health resources as part of their employee benefit program? And how is Ginger partnering with these businesses?
Let's maybe get into the COVID period now.
Yeah, let's do it.
And work backwards from there. Right now, employees are struggling from a whole number of stressors that amplify mental health issues, from loneliness to social isolation, to financial stress, to child care based stress, being around and not knowing how to handle your children and all those stressors, to relationship stress. All of these things are now sitting on top of employees.
That's right.
And as a board, as a strategic function for a company, in order to make sure that you're able to actually deliver whatever product or service you want to deliver, you have to be thinking about how employees are handling this period. You have to make sure that they have the resources that they need to build the resilience to be successful. If you don't, what you're going to see is productivity loss, absenteeism, turnover, and massively increased medical costs as these people struggle over time. As I said, this was true pre-COVID. We were seeing people on average missing 5 to 7 days per year due to behavioral health issues. Mm-hmm. We were seeing 67% of people crying at work due to office-based stress. We were seeing all these incredible stressors already. And now it's gone, I think, from being an HR benefits need to
Right.
a board level need.
That's right. Yeah, that's right. I think you hit it right on the head. We're looking at in our preparation for the second wave in our mental health PPE presentation is we are appreciating just the impact of isolation. We all have existential fears that our manic lives typically keep us from having to take a look at: fear of isolation, fear of losing control, fear of identity, and fear of death. And COVID, when you think about it, and the mandated quarantines has surfaced these four main existential fears: the impact of isolation, like you said, financial stress on top of that, relationship conflict. I'm not sure we're meant to be around each other 24/7, in our lives as couples and as families. It's very, very challenging. Fears of losing control, the uncertainty, the fear of death, all of these things coming into play. And I think our medical colleagues have done a stellar job addressing the medical aspects of this virus, but I firmly and truly believe it's going to be the mental health practitioners that continue to assist people, like you're suggesting here, managing their reactivity and responses to the pandemic. And I believe helping them not compound what's already stressful, regarding the various aspects of this pandemic. But I also think that mental health practitioners are going to be the profession that really help people put their lives back together after this COVID, crisis comes through.
I think that's right. I think that we are in the early phases of what could be described as a mental health pandemic, in addition to a
Absolutely
viral pandemic.
Absolutely.
There's good reason to believe that it's going to get harder once you actually do really start to open up, and you have this risk every day of walking into the office, potentially being exposed, not knowing if you really should be going, but because you have the option, but other people are going, so you feel the pressure to go do it. But then at home, you're a caretaker. You have to
Right.
You have to be careful about your at-risk parents. You have to be careful about your children and making. All of this is, again, additional uncertainty, additional questions, and leads to immense amounts of mental fatigue.
Yeah, I agree with that. I did some work with the military during some of my training, and the military has a protocol and a response to just about any situation you can think of occurring. They just got it nailed. But what we found is that some of the medical response and even some of the mental health response to a crisis like a pandemic, which we've long talked about coming down the pike, but I don't think we were fully prepared in the ways that we could have been. We're learning some lessons now, and I think some of the takeaway is what are we preparing for in the second wave? The medical profession is stocking up on the PPE and the things they need to be doing and access to care. And my colleague and I work with a group of physicians that are on the front line with COVID, and they talked about how there weren't protocols and strategies in place at the hospital level, and they were kind of doing it, kind of flying by the seat of their pants. My hope is that post-COVID, although it's going to be with us for the rest of our lives, like other things are, but my hope is that there are going to be protocols in place medically for the next pandemic. My hope also is that from the mental health perspective, we have protocols now that are in place that we're going to walk people through when we anticipate or are experiencing another pandemic. And I can see some of the stats and the measurements you folks are taking being part of formulating protocols that allow folks and practitioners, when from the mental health side, that when we go into another pandemic down the road or some other crises at a state or national or world level, that are right there, ready-made, turnkey, that we can walk people through, be prepared as professionals for. And I think part of what you folks are doing is really contributing to that protocol being shaped for down the road.
I think that's right. I think hopefully we're better prepared next time than we are this time. I certainly think that measurement techniques for building resilience, I compare it to the physical health space because people understand that better often, which is why I love that notion of mental health PPE. I think that it's an analogy that people can really attach to. Why do we exercise?
Yeah.
Why do we lift weights? Why do we stretch?
Yeah.
It's all preventative in nature. You're preparing yourself
That's right.
for what might come. And I think that building resilience and understanding how to be able to work through periods like this will get stronger over time.
That's right.
And just like you use a gym coach when you want to make sure you're doing it the right way.
That's right.
When you want someone to hold you accountable for continuing to do it, and you want that person to ask you to do that last rep,
Yeah.
Push you to do that one that you would never do if they weren't there.
That's right.
That's a lot of what Ginger's there for. It's about that accountability, helping you do it the right way, and helping you do that last rep that's going to build resilience.
That's right.
More strongly and more deeply over time.
What I love about that is, in the same way that we can get strong physically and we can, enhance our immune systems, physically and through, medicine or through, the things that we take as supplements, there is so much that mental health can contribute to people's lives. And unfortunately, the stigma or just some of the myths or some of the misunderstandings about mental health prevent people from appreciating all that they can do to complement. You're talking earlier about some of the stats in medicine. The last stat I did is about 68% of those presenting to their private practitioner, their internist, have as a core component of their medical presentation a mental health piece that's not being addressed, but it's being manifest through their medical presentation. And typically it results in a prescription or some, form of medical, treatment, when it's really an underlying psychological component. So I love this idea of being able to identify what mental health can really bring. It's a set of tools. And, we typically see it, with the Tiger Woods and the whole sports psychology thing, or, the Phil Jacksons and how they get into people's minds and enhance performance. It's the same thing to the average Joe out there that they can do with mental health. You're talking about, the resilience building, powerful, stress inoculation, booster, kind of almost like mental health booster shots along the way that kind of get you ready for a next wave or some upcoming stressors. EMDR, we can use that as well. Meditation, all the things you were describing earlier. These are things that we have access to in mental health that really folks don't know about, but we can understand they can increase the control of our lives. We can do these easily with practice. And boy, what an enhancement they can bring.
100%. The notion that people start to understand, the value of things like mindfulness, meditation, breathing. I mean, the funny thing about it is human culture has known about this for thousands of years.
Oh, yeah. Yeah.
And a lot of it's been lost in Western countries and in Western philosophies. But that's starting to come back, and people are starting to understand the value of it and how you can build that resilience and that resistance to whatever foreign body might be causing problems in your mental health. But I also think that the destigmatization is already happening, and it's exciting but problematic at the same time. It's exciting because if you look at the millennial and younger generations, there's very little stigma there. There's some pockets of stigma in some minority groups, but for the most part, those populations are very proud of their access to therapy and their focus on their mental health. The reason it's problematic, though, is the system couldn't handle the stigmatized volumes.
Right.
And so a lot of what's actually driving this need at the corporate level is that more than 50% of the workforce is now millennial or younger. And they're being overrun with demand for these kinds of resources. And there just aren't enough providers out there. So full circle, solving the supply-demand imbalance is critical, because if you destigmatize everybody right at the same time, there's nothing you're going to be able to do to solve for it.
Yeah. Really good. Well, Russ, we're coming to the close of our time, but before we close, help me understand, what questions haven't I asked that would be helpful for people to know about Ginger? And along with that, describe how one can access care and access the services that Ginger is providing.
Good question. I think the big thing to know is that Ginger provides on-demand mental health support for small to large employers. We range from our very largest employers like Delta Airlines of the world down to 200-300 person companies, and companies that want to make sure that their staff has access to mental health 24/7, that they have access to support, that they can build resilience, should look at Ginger. They can find us at www.ginger.io, and we'd love to talk to them.
That'd be fantastic. I know we're coming to the end of our time together, but this has really been a fascinating and really enjoyable conversation. Russ, congrats on what you've created, and well done on the lives you're touching and helping. And I really appreciate you being with us today.
Thank you. I hugely appreciate the work you're doing. I hugely appreciate that you're creating a vehicle for people to learn more about this and think more about it, and very much enjoyed it.
Really enjoyed being with you. And for those listening, thanks so much for being a part of our podcast. And we look forward to having you join us next time on Behavioral Health Today.
Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.